closure of Wellstar Atlanta Medical Center has had a big impact on emergency care in our area. Many hospitals report longer emergency department wait times. The Fox Medical team's Beth Galvin joins us here live on set with a look at how hospitals are responding to what's been a challenging time, Beth.
And Christine, it's been about 10 months since Wellstar Atlanta Medical Center closed, and the hospital that's probably been the most impacted is Emory University Hospital Midtown. They're only a little over a mile away from Wellstar AMC, and their emergency department treating up to 50 more patients a day right now. And keeping up has been a challenge for those who are on the front lines. When the news broke, Wellstar Atlanta Medical Center was closing its doors for good. Emory University Midtown Hospital emergency physician Dr. Natasha Terry remembers feeling shocked, knowing thousands of patients would soon be losing their emergency care.
And I think my second thought was, well, how do we mitigate that? What do we do next? Because we understand that we are going to get a good portion of those patients.
Emory Midtown's just a mile away from the former AMC campus, the closest hospital, and today likely the most impacted by this closure.
What we immediately felt was volumes in the emergency department.
And Emory Midtown's chief quality officer, Dr. Nicole Frank, says their emergency visits are up about 30% from last summer, jumping from about 170 patients a day to 220.
Our ambulance traffic certainly has increased approximately 54%, and that's just really in about the first 6 months since they closed. And we are continuing to manage to that volume and adjust, but it has been a challenge.
Like many emergency departments, Emory Midtown struggles with the issue of patient boarding. Because their inpatient beds are often at staffing capacity, they frequently have anywhere from 20 to 30 patients who need to be admitted but are waiting in the emergency department for an inpatient bed to open up.
So we are seeing about a 42% increase in emergency department length of stay for our patients who are admitted.
To try to speed up care, Emory Midtown has created a zone for patients waiting to be admitted and opened 2 mobile units for those likely to be treated and discharged home.
I think the biggest challenge really is just trying to make sure that we're providing timely care to a patient population that's been orphaned, essentially, and bringing them into the Emory Medical Home.
18 miles away in South DeKalb, Emory Hillendale Hospital's emergency department is under construction. Mike Steele's the specialty director of emergency services here.
We don't ever know what's coming in, and so it could be somebody coming in with respiratory distress or a heart attack, or it could be somebody that has ran out of their medications and can't get into their PCP or the primary care.
10 months after Wellstar Atlanta Medical Center's closure, ER visits here at the community hospital are up about 10%.
So what that looks like is like another 10 to 12 to 13 patients a day for us. Our ER itself, we have 25 beds for the care of the most acutely ill patients.
But with $12 million in critical funding from DeKalb County, Emory Hillendale is expanding its emergency waiting area and adding 10 to 15 new ER treatment rooms.
We just got so busy, and just too many patients, too few rooms.
Yeah.
And so having 5 or 10 extra beds like we're getting now it's going to be a game changer for sure.
The DeKalb funding has also helped the hospital buy a new CT scanner and expand its intensive care unit.
We right now have an 8-bed ICU, and then we have what we called an overflow space.
Emory Hillendale's chief nursing officer, Edna Briscoe, says they'll now have enough room for 15 ICU beds.
We'll be able to move both of our ICUs into one space, which will allow us to be more efficient with our patient care and our staffing.
Back at Emory Midtown, Dr. Terry says her team has become good at pivoting and pushing forward.
I'm really proud of our team and how we as a community at large have come together to really bring these patients in and make sure that they are receiving appropriate, timely care.
And Wellstar Atlanta Medical was one of only 2 level 1 trauma centers in Metro Atlanta. And on Friday, we're going to look at how the closure of that hospital and that trauma center is affecting trauma care across our area. And Christine, it's having a big impact.
Yeah, just a closure of that building and their services, that trickle-down effect it has throughout the community.
Yes.
Obviously, you see it.
Patients, emergency care, trauma care, all of it.
Yeah. All right, Beth, thanks so much.